Hello everybody and welcome back. Today we're going to continue talking about the polygram. For a quick revision, the polygram is the analysis of the cardiac activity. And the electrical activity is measured by the electrocardiography or the ECG. Okay, for the last video we talked about the atrial pressure curve and the venous pressure curve, which is recorded at the jugular vein level and can also be called the jugulogram. Today we're going to talk about the aortic pressure curve, which is recorded at the carotid artery level and can also be called the carotidogram. And we will also talk about the phonocardiography, which records the heart sounds. For the cardiac cycle, it causes the flow of waves in the aorta and the peripheral vessels. With the closing and opening of the pulmonary and aortic valves, blood flow and blood velocity across these valves oscillate from near zero when the valves are closed to high values when the valves are open. Blood flow in the aortic arch usually oscillates between slightly negative and highly positive values. Pressure in the aortic arch typically oscillates between 80 to 120 mm mercury. Phasic changes in pressure and flow also occur in the peripheral arteries. Arterial pressure is usually measured in a large artery such as the brachial artery, which is the measured systolic and diastolic arterial pressures, as well as the pulse pressure and mean arterial pressure. Closely approximate the corresponding aortic pressures. And now there is a small graph that shows the comparison of the dynamics of the left and right ventricles of the heart. Now we're going to be talking about the phonocardiography, which is recording the heart sounds. The heart sounds and the phonocardiography the heart sounds are relatively brief, discrete, auditory vibrations of varying intensity, loudness, frequency, which is the pitch, and quality, which is the timbre. The first heart sound identifies the onset of the ventricular systole, and the second heart sound identifies the onset of diastole. These two oscillatory events establish a framework within which other heart sounds and murmurs can be placed and timed. Listening to the sounds of the body with the aid of a stethoscope is called auscultation. The stethoscope can detect leaks in the valves that permit jets of blood flow backward across the valvular orifice, example regurgitations, as well as stenotic lesions that narrow the valve opening, or forcing the blood to pass through a narrower space, for example stenosis. During certain parts of the cardiac cycle, blood passing through either regurgitant or stenotic lesions makes characteristic sounds that are called murmurs. So murmurs are blood passing through either regurgitant or stenotic lesions, which make characteristic of sounds that are called the murmurs. The phonocardiogram is the recording of the oscillatory cardiac activity using a transducer placed on the thorax. The movement of the valve leaflets can be detected by the echocardiography. The chest surface areas for auscultation of normal heart sounds are different. For the primary aortic area, it is the second right intercostal space adjacent to the sternum. The secondary aortic area is the third left intercostal space adjacent to the sternum, known as the herb area. The pulmonary area is the second left intercostal space. and the tricuspid area, which is the fourth and fifth intercostal spaces adjacent to the left sternal border. And finally, the mitral area, which is at the cardiac apex, which is the fifth left intercostal space of the mid-clavicular line. So this was all for this video, and for the next video we're going to discuss every heart sound in detail. Thank you very much, and hope to see you soon again in the next video.